Hollowell, immediate past general counsel to the Detroit NAACP. And we didn't just start working on insurance when D-insurance came up. Butch has been with us with the NAACP. I'm glad to hear some of the questions that were raised, because I'm certain he will touch on all of these issues that were covered. But we have a champion in our midst, not just on insurance, but for the city, for civil rights and social justice advocacy. And it's a pleasure to bring back home to the NAACP. We call him Butch, but for the record, we'll call him Attorney Melvin.
Thank you very much. Let's see if I can get this to work. Okay. So you raised some good issues, and I started working on auto insurance in 1986. It was the first assignment that I had when I was nominated for the NAACP board back in 1986. I was the young person on the NAACP board. And the assignment was to look at why the rates are so different in Detroit than in some of the suburban areas. So we began by, I had a mole that worked with me, basically somebody that worked for one of the large insurance companies, and I got data and was able to put on a map of the entire city every rate zone that is used. A rate zone is an area that has a number associated with it. It looks like a jigsaw puzzle. This is how inappropriate it was. That when you looked at it, sometimes one of those zones would be 2 blocks by 3 blocks, and that's not drawn in such a way that could be statistically significant. So we ended up drawing that entire thing and put it on a board, and then I did some modeling so that I took, for example, Van Dyke, and we looked at all the rates going up Detroit, and then we hit the suburbs. I looked at Michigan Avenue, and we take that, and when the rate was a certain rate in Detroit, when you hit the Dearborn border, the rate would go down. Keep going on Michigan, you hit the border of Inkster, went up. Keep going, you hit the border of Westland, went down. And so that study that I finished in 1988, the NAACP sent me to Lansing to testify in front of the Senate Commerce Committee. At that time was chaired by Dick Posthumus, and we advocated for legislation on that. Further, we did file a lawsuit, and a very costly one. I think it cost us $140,000 for expert testimony. We went across the nation to raise the money that is needed for an expert witness. We filed one. There was another suit filed in St. Louis, another similar suit filed in Philadelphia. None of those suits were successful. We did settle the case with AAA on terms that the NAACP felt was fair at the time. And I'll show you that what is underlying these rates right now and what we should be doing about it. We have a unique system here in Michigan. I think Governor Milliken, who I have a lot of respect for, had the best of intentions in 1972, January 5th of 1972, when he laid out this thing called no fault. And he had standing with him Dick Austin, who was then the Secretary of State, Millie Jeffries from the UAW, he had Frank Judge from the Ford Motor Company, and the insurance commissioner at the time, and he laid out this plan. He said, basically what I'd like to do is to get out of the mess that we're in. And the mess that we were in was that everybody was just suing everybody like the Wild Wild West, and people were in hospital beds and they weren't getting the treatment that they needed and deserved on a timely basis. And they said, but if we do this, and we make sure that we now mandate that everybody has insurance, and remember, this is, auto no fault. No fault is not a free market system. It is a mandatory system. So unlike all the other states in the country, except for 11 others, you must buy insurance in Michigan. It's not the case in all the other states. There, your health care coverage covers you. Here, you must buy it. And so their theory was, if you have everybody buying it, then what's gonna happen to your rates, they said? It's gonna go down. Did that happen? Nope, sure didn't. In fact, rates went up. And so here we are, having worked through the legal system, having worked through a series of bills in 2008, which then we had a Democratic governor, a Democratic House of Representatives, we had a Republican Senate, and had a package of 10 bills that we put forth then. I think most of you remember that didn't succeed. We think we have a chance with this legislation. So here's the crisis, and the crisis is nothing that's new to anybody here, and that is we spend about $3,400 per year in auto insurance annually. Now, we all know that that is a very conservative number. We know that there are other very respected entities such as Runzheimer's and Insure.com, which say that we pay about $5,000 a year. So that's a conservative number. The average rate in the suburbs is about $1,700, so it's about double. It's the most expensive. So what they do is they make you buy, in Michigan, the most expensive coverage in the nation. So, and if you don't do it, most people don't realize that there's criminal penalties. Half drivers are uninsured. If they're caught, subject to misdemeanors, which is $500 or a year in jail. So it criminalizes you if you don't buy insurance. And what we know here is that number is probably closer to 60%. Why do we know that? It's because when the police give you a ticket, they don't always give you a ticket for lack of proof of insurance. You may not have insurance. They don't always do that. So we know that number is higher than 50%. It's about 30% statewide, but so it's still very high. So what makes up the cost of insurance? Later on today, we're doing the actuary, which the city council authorized us to hire, is going to walk through these numbers in detail. It's a 6-month study, but the company that we hired is the best in the nation. So there's numbers. So basically, what makes up your premium? Bodily injuries. So that's called 20-40-10. So if you pull out your bill and look at your bill, you'll see it says BIPD, bodily injury property damage. That's about 6,000. 20-40-10 means, God forbid, someone gets killed or very seriously injured. You have $20,000 for one. 40, that means 40,000 if more than one is injured in your car, and 10,000 for property damage. 20-40-10, that makes up about 6% of your premium. Now, haven't they always told us every year that they're stealing all those cars in Detroit, and that's why your car insurance rates are so high? That's what they've always been telling us. This tells you that's not true. That's about 18% of your premium is auto. Collision, car damage is about 31% of your premium. By far, the biggest portion of your premium is the healthcare portion. That's PIP. That's 100%. So that's the biggest single part of your premium is the healthcare coverage. Now, about a third of us don't buy the collision part of it. We just buy the mandatory coverages, which is the liability portion. So if you just do that, then PIP becomes 88% of your premium. So how does it work? It's really double coverage. That's really what it is. If you really break it down, it's double coverage. So right now, I buy health insurance. Let's say I've got Obamacare, or I've got VA, or I've got Blue Cross, or some kind of health insurance. I already have coverage for when I get injured. No Fault says, even though you've already bought coverage for that, we're going to make you buy it again. So you're buying twice for the same thing. So most people already have health care coverage. So either through your employer or Obamacare, Medicare, Medicaid, VA. So if you fall off a ladder and you break your shoulder and you go in for treatment through the emergency room, and later on you have to have an MRI and rehab, your health insurance, and we know that 90% of Detroiters now have health insurance. 110,000 signed up just last year alone through either Obamacare or the expansion of Medicaid. So we only have about 62,000 Detroiters that don't have some form of health insurance now. So Obamacare has been a big success. So I fall from there, and my health care coverage kicks in. I have a certain amount that they pay for fixing up my shoulder and getting me a cast and all that. But when you buy car insurance, you're paying twice for that same injury if you happen to break your shoulder in a car accident. So now you're paying twice. Now, what's the difference between Medicare, Blue Cross, and HIP? So when you go, and I broke my shoulder, and I've got Blue Cross, Medicare and Blue Cross. So Medicare, the hospital gets a reimbursement of about 8 cents on the dollar. You've got Blue Cross, the hospital gets a reimbursement of almost 100% on the dollar, about 9 cents on the dollar. How much do you think the reimbursement rate to the hospitals is for your auto injury? Is it about the same, would you think? Higher? Lower?
Higher.
Higher?
Higher.
300% reimbursement. So you're forced to buy healthcare coverage double, and the hospitals get reimbursed 300%, 3 times what it actually costs. So, so what does that do? Well, that creates an incentive, to use that system. So they get 300% reimbursement rate. Well, would that be fair? Now, why would that be justified? So if I'm an emergency room, I do have to staff up, right? I've got to have nurses and emergency room doctors and specialists that are there. I've got to have the most sophisticated kinds of equipment. So there might be some justification at the emergency room or at the hospital end for that 3 times reimbursement, because look, I can't just build an emergency room for when somebody comes. I've got to have it and be at the ready for when somebody comes. So maybe there's some justification for that. But when you get your MRI scheduled 2 months down the line, should they also get the 300%? We don't think so. So why are the rates higher? So collision claims, suburbs, about 8 per 1,000. Would you say that Detroiters get into accidents more, less, or the same as suburbanites?
Less.
Less? Anybody said more?
The same.
Same? Exactly the same. Okay, so we get into the same number of accidents as suburbanites. So we get into, you always have the arguments, you've heard the arguments, I certainly have since I've been on this for 30 years, that, well, because of density, okay, you have density in urban areas, and therefore you have more collision claims. That turns out not to be true. And it could be that Detroit is also bigger than most cities in the United States. I mean, you can take Chicago and New York and fit them in the southwest side and not find them. Detroit is 139 square miles. But this disproves the fact that we get into more accidents. We do not. It's the same.